and welcome to Public Health Matters, a monthly program dedicated to discussing public health issues in our community. This program is sponsored by the Middle-brook Regional Health Commission, which serves the towns of Bound Brook, Greenbrook, Middlesex, South Bound Brook, Warren, and Watchung. My name is Colleen McKay-Wharton, and I'm the health educator for the Commission and the host of this program. Our goal for Public Health Matters is to give you a program that will provide useful information to help you better understand important public health issues, and in particular, what you can do to reduce any risks associated with them. For today's program, we will be discussing prostate health for men, what the role of a prostate is, medical concerns that men should be aware of, and what prostate screenings are most often recommended. Today's program is sponsored by the Somerset County Cancer Coalition. And our guests for the program are Dr. Keith Harmon, a urologist with Somerset Urological Associates in Somerville, and Ellen Levine, Program Director of the Wellness Community of Central New Jersey, which is located in Bedminster. Thank you both so much for joining us today. Dr. Harmon, why don't we start with you? Before we get started with looking into the different screenings that are available, can you tell us a little bit about exactly what the prostate does?
Sure, absolutely. First of all, thank you very much for having me on the program. It's a pleasure to be here.
Thank you.
The prostate gland has two functions. It's actually a conduit for the urine. The urine goes from the urinary bladder through the prostate and out through the urethra when a person urinates. It also is a gland. It secretes the semen. Different glands empty their products into the prostate, and the prostate itself also contributes parts of the semen, and it contributes to the semen production.
Okay, so two very distinct functions that it's associated with. Now, I know there are really a few different areas of concern in terms of prostate health and things that men and their families should be aware of. Can you tell us a little bit about what those are?
Sure, absolutely. There are several different kinds of prostate conditions. The most common is benign prostate enlargement, benign prostatic hyperplasia, known as BPH. This is something that happens as a man gets older. The prostate gets enlarged, and a man can have urinary difficulties, increased frequency of urination during the day or at night, and difficulty passing the urine. It doesn't happen in all men, but a significant number of men have that condition. Also, a condition called prostatitis, which is an inflammatory, infectious process that can happen in young men, middle-aged men, and older men, where they have an acute change in their urinary pattern, where they can have pain on urination, difficulty passing their urine, even have a fever. That's to differentiate that from prostate cancer. Prostate cancer usually has no symptoms, especially in its most early stages. So the idea that I can't have prostate cancer because I feel fine and I have no urinary complaints doesn't make sense because of that. Prostate cancer only in its very late stages will feature symptoms, and luckily we see very little bit of that.
You know, if we can step back for a minute, BPH, when you referenced that and you described that it may happen to most men as they age, so is it safe to say that all men will at some point be affected by that, or is that too general of a statement?
All men's prostates will grow as they get older because it's exposure of the prostate gland to the male hormone testosterone. And all men's prostates will grow in size, but not every man will experience symptoms from the enlarged prostate. We can have men with very large prostates who have almost no urinary complaints, and we can have men with very small prostates who can experience urinary complaints and difficulties. So it's not, a direct relationship all the time. But essentially, if a man does have a prostate growth, and every man's prostate can grow at a different rate based on genetics, then they can develop symptoms of urinary control, urinary function. So it's not that everyone will develop those symptoms, but a significant number would.
All right. And are they necessarily, let's say they are not experiencing any symptoms with BPH, is it something that necessarily would need to be treated for it becoming enlarged, or if there's no symptoms?
If there's no symptoms, usually there's no reason for treatment. It's important that, as part of a general screening, that men should have their urine checked for infection and be evaluated. Very rarely will a prostate condition be silent. But usually symptoms will happen earlier than damage to the urinary tract. So symptoms usually are the warning signs that there might be something going on, and treatment can be instituted, which will make a man feel much more comfortable and urinate much more normally.
Right, okay. Now, So the two that you've mentioned first, BPH and prostatitis, while those are, certainly can be very uncomfortable, I think the biggest fear that we hear very often from men is about not going for screening because of prostate cancer, and there's a real concern, obviously, about that. But what exactly is happening with prostate cancer as opposed to, a prostate becoming enlarged like with BPH?
Sure. Well, it's changes in the cellular structure.
Okay.
A cell turns cancerous. It grows uncontrollably rather than being under control the way our non-cancerous cells are.
Okay.
The exact molecular changes have not been elucidated yet. But it's not enlargement of the prostate, it's just change in the actual cellular structure where these cells grow uncontrollably and replicate very quickly. And then if they grow to a certain size and the tumor, if one develops a prostate cancer tumor, will grow to a certain size, and the concern is that it can spread to neighboring organs or to distant areas of our body and impact a man's lifespan.
Right, okay. Now, you mentioned that with prostate cancer, you don't really see the kinds of symptoms that you see with BPH or prostatitis. So is that something that is detected only through a screening, or is there some other clue?
Well, as mentioned, most often prostate cancer doesn't have symptoms, but often men who have prostate cancer have concurrent BPH enlargement. So it's hard to differentiate whether their symptoms are from BPH benign enlargement or whether it's from prostate cancer. But typically prostate cancer itself doesn't give you symptoms. So therefore screening would be recommended in the right age group and profile. The screening would be a blood test as well as a digital rectal examination. And that would uncover prostate cancers, which usually are quite silent. There are patients who come to see us or to see a primary care physician who have general urinary complaints, probably stemming from benign prostate enlargement. But part of their evaluation should be screening for prostate cancer to rule out that more dangerous condition.
Now let's talk about that blood test for a second. Is that the PSA, right, that men are certainly recommended to receive at a certain point?
Yes, it's the PSA, which is prostate-specific antigen, and it is a blood test that is done routinely in all laboratories, and it should be part of prostate cancer screening in men age 50 and older annually, for African American men at age 40 and older annually, and for a man who's had a brother or a father who've developed prostate cancer below age 70, it would be recommended age 40 and annually. Furthermore, all men should have, in my opinion and in most urologists' opinion, should have a baseline PSA at age 40 as a baseline, because there are men who develop prostate cancer very early on in their 50s, and it would be important to catch them earlier at a more curable stage.
Right, okay. Now, and you also mentioned, in addition to the PSA as a screening, there's a digital rectal exam. And does the same timeline apply for that, or is it a different timeline for those screenings?
Well, a digital rectal examination should be performed of all men age 40 and older. I actually, when I see a man for different conditions, if a man's 30 and older, I will do a digital rectal examination. A digital rectal examination should be part of any man's, whether he be 20 years old or 40 years old, should be part of his screening, because that's also the way that screening for colon cancer can be done, by checking for blood in the stool. So a rectal examination in itself involves checking the prostate as well as checking the rectum.
Okay, so it's looking for some other things
Correct.
as well to be cautious. Now, you